Hi everyone, this is 1 Year On. I'm Alison. And following on from my previous episode, today's episode continues the interview series. And I'm fortunate to be able to interview my wonderful speech therapist, Laurie. She's joined me today. And firstly, I need to read this disclaimer to you. This episode is general information. It's not medical advice and doesn't replace assessment or care from your own clinical team. If you have concerns about your health or recovery, please seek advice from a qualified health professional. Okay, so after that, I can say that many people do require speech therapy after having stroke, and I was no exception. I thought it was useful to talk to Laurie about speech therapy because it's really wide and broad and covers a lot more than just making words with you, May. Welcome, Laurie. Thank you for coming.
Thank you very much for having me.
Can you introduce yourself, please, for everyone, and mention where you work and talk about the breadth of your work as a speech pathologist?
Yes, I'm happy to. So my name is Laurie. I work at Brindabella Speech Therapy. We're formerly known as Brindabella Hearing and Speech Center, but that company has changed and we're now an independent speech pathology company called Brindabella Speech Therapy.
And then speech therapy as a discipline is really wide and varied, isn't it?
It definitely is, yes. The general public hears speech therapy and all they think about is pronouncing words. I think members of my family think that that's what I do. But yes, we cover quite a few areas. For example, the list could go on, but yes, we do cover speech production, which can be difficulties pronouncing speech sounds. It certainly could be one of them, but it also encompasses the motor planning and execution part of it. We cover fluency, language, both the comprehension, understanding language, and the expression or use of language, oral and written, social communication. Small children is pre-linguistic communication, things like joint attention and lots of early learning skills. Literacy is one people don't realize. Cognitive communication, so working memory, attention, executive function. And then also a big area is voice and swallowing. And those are the two that often we get referrals from GPs, ENT specialists, and so often a client will say, I don't really know why I'm here. My doctor just told me to come.
Fascinating.
And so, yes, we treat voice disorders, swallowing difficulties that are caused by various reasons.
Would you treat something like one of the vocal tics, like say Tourette's or something?
That is a bit different. It does come up. And so I think we would refer to a neurologist for that type of treatment, but a voice assessment could be helpful in teasing out what's actually going on. What's going on.
That's fascinating. Quite a few of those things that you just mentioned, I didn't realise. And I've been to speech therapy myself, and I've taken my son when he was younger, as we've discussed before. So that's really interesting. Speech is very wide and varied.
It's quite wide and varied, and most, it's really impossible to be an expert in every area. We're trained in university for our qualification. We get, quite extensive training to cover the core areas. But you'll find that most speech therapists tend to start to focus in one, certain areas, whether it's general pediatrics or I've ended up focusing on adults, and that can be quite wide and varied as well. But yeah, it's pretty hard to be an expert in every area.
Well, it is such a wide discipline, isn't it? So my first question there was, what surprises people the most about the breadth of speech pathology work after a neurological event like a stroke?
Yeah, like a stroke. So yeah, I think a big one is swallowing. Swallowing, I feel like, is one of those things that you never think about till something goes wrong.
Because it just happens, doesn't it?
Yes.
But it doesn't just happen.
Yes, right. It's quite a complex process that is normally automatic, and then it can be affected with a stroke. So that's probably a big area. And I think just the language and cognition again, because people just think speech, oh, I'm speaking fine. But I think they don't quite realize that we're going to work with people and help them with the language piece of it, social language even, and then some of those cognitive linguistic components.
Yeah, it's funny. I mean, I walked into the hospital as we discussed way back, and I was able to speak, but there was a lot of deficits for me, and it was not really apparent at the beginning. So that was really interesting. So when somebody is in the hospital or they come home from the hospital, how would they access speech therapy?
Yeah. So here's where I'll just say up front, I'm not an expert with the pathways. As you can hear, I'm not Australian, so I've lived here for a long time now. But I've only worked in private practice,
Right,
so
okay.
I'm not as familiar with the public pathways. But someone can self-refer to Canberra Health Intake. That can be either GP referral, or you can self-refer to access services through the public system. And so I'm not sure the ins and outs of that pathway, but I know Canberra Health Intake is where, you can self-refer, or you can self-refer to private practice. I feel like most people who've had a stroke have been part of the rehabilitation team through the hospital. And so hopefully they have provided some information with, here are your options for accessing services. But I understand it's not overly easy to access services. I don't know what your experience was, but I think it can be challenging sometimes.
I think the public system, it's difficult in terms of getting an appointment quickly. I was able to get in to you guys really quickly.
Yeah.
Which was amazing. And I ended up getting a referral from I did the assessment first, and then I had to pay for that, and then I can't remember what it's called, but it was like an allied health plan that covered partial cost of the sessions with yourself.
Yes.
And I think that Medicare supports that. I think it was up to 5 sessions or something
up to 5 sessions. And that plan does come through your GP.
Yeah.
I think it's still called it might have changed, chronic disease management plan.
That's right.
Yeah.
I don't remember these things. I just remember getting that from the doctor, and she said, look, take that. That will help you.
Yeah. Yeah.
But in terms of getting an appointment, for me, it was a case of just phoning up the phone number. But
I'm glad you caught us at a good time, because sometimes in private practice, unfortunately, we've had wait lists as well.
Yeah,
At Brenda Bella, you may have had to wait a few weeks. At Brenda Bella, we have a little bit of leeway with prioritizing recent acute neurological events, because we recognize there's, you want to jump on recovery early.
Oh, true.
And so we don't want someone, sometimes it may be unavoidable, but we just don't want someone who's had a new stroke sitting on a wait list, and you're losing this important time. And you could probably argue that for a lot of areas, but, we generally don't triage a lot, because everybody needs help, and how do we sort that out? But we have flagged a couple of areas, and one of them is a new neurological onset.
I think I got a cancellation. I think I was just in the right place at the right time.
And that is ideal. Yeah. And I'd say for anyone who's looking to access services and is having to wait, like, if you have the flexibility to take a cancellation, it never hurts to say, do you have a cancellation list? And also just ring up. Like, you're not bothering reception. Just ring to say, oh, I'm just checking. And if you've had a cancellation, because maybe that morning somebody canceled.
Well, this is it.
And you can take the appointment.
And given that you're at home because you've got to rest and recover,
right.
You're available to
flexibility, yes.
Even if it means you have to get in a taxi to go, or, as it was with me, Andrew came home from work and brought me, As I say, I'm very close to your clinic, which was ideal, but when I went for the assessment, I had to go up to the Gungahlin Centre, and that felt like forever.
Yeah. Yeah,
And
it was a bit more of a drive.
It was a bit more of a drive.
But again, because
but
you
it
were
was good.
willing to be flexible, that got you in. And some people may not have the transport options, but if you can be flexible with where you're going and days, that is helpful.
I mean, you only have to do that assessment once for this situation, and then obviously the therapy sessions, it is in the same place each time.
Yeah.
So the speech pathology assessment, can you explain, because I do remember bits of mine and being quite distressed at points. Well, because I could see where the gaps were.
Yeah.
But can you explain what's been done during all the questions and what's actually you're trying to assess within each person?
So we would have sent you a questionnaire that you filled out ahead of time, and I think you also sent through your discharge summary from the hospital, maybe?
I can't even remember.
I'm not sure. And my colleague did your assessment.
Yes.
So, she would have better memory of it. But so basically we gather information beforehand, have an idea of what you need, because it could be, like I said, it could be motor speech, it could be swallowing, voice, so we get a bit of an idea beforehand. So we knew from your information you had highlighted language, word finding, and so that's how we have a bit of an idea of what assessment we're going to do.
Oh, okay.
And so we knew from your information that we were going to be looking at higher level language function.
Okay.
And so that's how my colleague selected the assessment.
So you have different tests.
Correct.
So say somebody has lost the power of speech completely.
Yes, we would be doing something different.
Okay, right.
And so with stroke and language, it can, I always have a plan A, B, and C in my head, because I may think I'm doing plan A, and then I meet the person, I think, you
have to go down a different
because
road.
I will say, generally assessments are designed to highlight the areas of difficulty, so they tend to be deficit based because we're trying to look at where you're having difficulty. So it's frustrating and it's hard, and we can't give you cues and help. We just you have to let
asking. The person fail.
Yeah,
because then you have to see where they're failing.
Yeah, so it is kind of finding that balance of the appropriate test to highlight areas of difficulty, but at the same time not having it be so difficult and frustrating. So just recently, I've been in an assessment where I've started maybe the higher level language test, and I've gotten partway in and just thought, this poor person, this is too difficult. And they're just going to walk away feeling quite, terrible. And I've shifted gears in the middle of that, because at the end of the day, the most important thing we want to know is, what are the areas of difficulty? What are some strengths? And then selecting goals. We want to know, where are we going to go with this? And so sometimes, I think when we come out of uni, it's quite like, we need to get through this, specific assessment test and get a score and actually I find that's less important once you're getting experience in the field, and it's more about, do you have the information you need to select appropriate goals for this person, which includes having their input, and do you just want to be able to create a beneficial therapy plan for the individual that's going to suit their needs.
Because everyone is different, right?
Everyone is very different. And people's priorities are different. So the other thing with you is that, your goals were, you were at that time you wanted to return to full-time work at a job that was demanding. And so we knew that's really where we were trying to go, where somebody else, it might be different. So that makes a difference with the therapy.
And I remember my assessment was the things that I got really upset about, and I asked Andrew to leave the room. I started crying.
Okay.
It was awful. And it was the name as many words as you can starting with the letter, or the lady was reading out a sequence of events, like a little story, and then I had to repeat it back to her, and I couldn't because the memory aspect of it was really bad. And then there was another one, you're right, it was about the deficits, very much so.
And Yeah.
That was hard.
And it's,
I felt really defeated coming out of that. It was like, oh my God, I didn't realise I was so bad. Sort of thing, you know?
Yeah, and that feedback, you know, is helpful for me to hear, because some of the younger, like the newer people coming out of uni, there is more of a focus on how do we do more of a strengths-based assessment, so that you're not feeling quite so terrible, because it's a hard thing and we don't really want that. But at the same time, it's finding that balance of like, well, we kind of do need to see where you're struggling, because that actually helped drive the therapy and we knew. But at the same time, I think maybe we need, you know, balancing it a bit more of identifying strengths is an important piece.
I wonder whether explaining to the person that this will show up, the deficits, so to not be dismayed because this will be confronting, to sort of, what's the right expression, to be managing their expectations
right up front,
right? This is going to be a horrible experience for you because well, you know,
I know,
because we need to see where the gaps are, and while we love your strengths, we can't help. Well, there's no point in us helping you on your strengths because they're already strengths. We can improve on them, but the main benefit for you in the work that we will do is by looking at where the gaps are and the things that you're struggling with. And maybe, you see, I had no idea what the assessment would be, and because I've always been a person who has been very articulate and, you know, being able to talk for hours and hours and never getting tired of having a conversation with someone, to then suddenly be in this situation, that was really confronting for me.
Those are very good points, and
it's not a criticism,
not at all,
it's
but
just
I think
a reflection.
And it's really helpful for us to hear that feedback, because again, we're in a situation where we do this all the time, and we probably maybe forget a little bit the impact on the person. And I think too, to be able to say, you know, we can't help you, we just are going to present this. And I
mean, I haven't actually ever thought about this before we've started this conversation today, and it was just, I thought I should share that with you, only because it might actually help if someone knows what they're in for before that they start the assessment.
Yeah, definitely. No, I think that's a really good point.
Anyway, sorry, this wasn't meant to be a let's tell you guys what's wrong.
But again, for anyone just a bit of listening, that it's great to share that feedback, and I think as professionals we do want to hear that to help us provide a better service and provide a more positive experience, or just do what we can to help someone along the way.
So I did remember feeling really, really defeated at the end of the assessment, and that was horrendous. But now knowing what the actual intent of the assessment was, I can actually see that had to happen. So, you know, that's just a little aside.
And can I just say, and I think too, it's, again, we'll say this throughout, like, it's so different for each individual. Because you had your insight and awareness was very intact, and so you were pretty aware of where you had difficulties. And it's funny, as a speech pathologist looking at your assessment, like, you actually did quite well.
Did I?
Yes.
I didn't think I did.
So that's, but then you think, well, it's all relative, because to you,
true.
it was, you just bombed. And, you know, to me,
it.
I'm like, well, you know, there were just a couple of areas that were difficult.
If you've enjoyed this episode, please like, share, and subscribe. I will be back next time to share more of this interview with Laurie, which is really interesting and gives us greater insights into the world of speech therapy. Thank you.